All right, Aaron, I think we are live now.
All right.
Appreciate you joining us. I Thanks for helping us bear with the technical difficulties. I'm not that much of a millennial, apparently, to be able to stream a Zoom onto Facebook Live from our own house. So thanks
No
for
problem.
bearing with us, and thanks for making the time tonight.
Thank you.
Wanted to start by, for those who don't know, who are watching on our page right now, my name is Sam Scarden. I'm a candidate for the South Carolina State Senate in District 41. My day job is actually small business lending, so I've been working a lot on the small business side of this crisis, trying to support borrowers and some of the smallest businesses in Charleston, our local businesses, try to weather this crisis and get through it. I think it's really important that we are all seem to be pitching in and doing our part right now, and that's why I asked my friend Aaron White to join us today. Aaron's a social worker, and I think that's a very unique and important perspective to have in this crisis, especially as this is trying for so many of us who are faced with the health realities of it, the economic realities of it, the confinement in our homes. It can be very isolating. So I wanted to chat with Aaron for a few minutes today about what he's seeing in his role and what we can do to support our community. So I'll turn it over to him to let him introduce himself, and then we can take it from there.
All right. Well, thank you so much, Sam, for having me this afternoon. It's really an honor and a privilege to sit with you really once again. Definitely a good friend. And my wife and I do extend our condolences to both you and Leslie and your family. I know you're dealing with the passing of your grandmother, and that's never easy, but just know that we are definitely keep you in our thoughts and in our prayers. Thank you so much for having me today. I know a lot of folks in the Sea Island community. I've been born and raised on the Sea Islands, specifically Wadmalaw Island, but my day job is a social worker. I've been a social worker for a number of years. I did my bachelor's in psychology. I have a master's degree in social work from the University of South Carolina, and I am a licensed social worker in the state of South Carolina. My specialty is dealing with health and mental health. In the community, I also serve on the Wadmalaw Island Land Planning Committee, where I head the subcommittee on education. And then I also serve as the co-chair of the Sea Island Democrats, which really started about a year ago. The vision and the idea for Sea Island Democrats was there long before then. But I had an honor and a privilege to serve as the co-chair for a little over a year, and was just recently reelected as the co-chair on Tuesday night. So such an honor and a privilege to serve there as well. So I do a few things in the community, but mainly, of course, my day job is as a social worker and therapist in the state of South Carolina. Sorry, Sam, I think you're muted. Sam, I'm having trouble hearing you. Sorry, I think you might be on mute.
There you go. You're right. I apologize.
All right.
Cool. Well, I was going to say, I meant to congratulate you on being reelected as chair of the Sea Island Democrats. I apologize I didn't lead with that, but I think it's really important to have young new leaders in our party and in our state, and I'm glad to see you carrying the mantle on that front as well.
Absolutely.
Can we talk a little bit about the crisis going on in front of us? What are some of the changes you've seen? What are some of the issues you've seen out there in the social work field as a result of this crisis?
Yeah. So trying to with the time restraints that we have, it's so much, Sam. Honestly, we've seen a tremendous change in the social work community as it pertains to still meeting the needs of the community while dealing with COVID-19. Social work is a very, very diverse field. It's part of the reason why I got into social work in the first place. You find social workers everywhere. Some serve as therapists, some serve as counselors, You find them in schools, hospitals, prisons, wherever you go, you can usually find a social worker in various different fields. And so each field has kind of adopted different methods to deal with COVID-19. But specifically in my field, where I specialize in health and mental health, a lot of what we are dealing with right now is how do we meet the needs of many of the folks that we serve, while being safe and giving attention to the health needs of these individuals. So one of the major changes that we've seen in the social work community, as it pertains to therapy and a lot of clinical work, is understanding that a lot of the issues that were going on before, as it pertains to mental health, those things they're still occurring. It doesn't change. So we have to adapt with COVID-19. And one of the greatest methods that we've been using recently is telehealth. So telehealth allows us, similar to how we're doing right now, allows us to have communication in a safe environment where maybe I'm in my house or I'm in my office, but I'm still able to access the clients that I serve and be able to provide them with the mental health counseling and services really that they need. Like I said, those needs really, they don't change just because COVID-19 is going on. So we had to find different ways to really accommodate. So that's a really huge step forward for the social work community as far as serving our clients.
Well, and I imagine when you're doing telehealth too, people have to remember to unmute themselves. Um, I'm curious. We're going on almost 2 months of this crisis now, of people being very isolated, sometimes at their home alone, sometimes in the wake of the passing of a relative. Um, it can be kind of depressing, bleak times for people. How does someone know when it's time to really reach out and seek help? Do you have any suggestions on where people could go for help, and where that line is that you cross in your own mind to, I should really reach out to someone here. I need some help getting out of this situation.
Yeah. So that's really, Sam, a two-part question. And I say that because it's a responsibility of individuals to realize when they're really having those issues, and finding those ways to really reach out and get the help that they need. But then on the reverse side, is also good for us as individuals to reach out to those that we know, that we care about as well, to check on them really in this crisis. Because really right now, with being socially distant from individuals, folks that are dealing with anxiety, a lot of folks that have been dealing with suicidal ideation, suicidal thoughts, and various mental health issues, those things still occur, and really they're more exacerbated in an environment like this, because they are socially distant from a lot of folks that they could rely on as a support, or going to the beach, or doing anything that seems to be a good coping mechanism. Those things are not readily available anymore. So folks that are really dealing with those complex issues, it's good for them to know that you can still reach out to like Charleston Mental Health, for instance, and various mental health agencies. If you're a veteran, you can still reach out to the Charleston VA or the VA in your area. There's a number of different agencies that are still working. They're still accommodating clients who feel like they're really going off of the deep end. Another thing, Sam, is that's really important is understanding that we all have an individual responsibility in this crisis to really reach out to the folks that we know and really do check-ins. You know, we can call and say, "Hey, mom, how you doing? Hey, dad, how you doing?" Or any of those friends that you know are dealing with depression and feeling a little bit down before this. It only just takes a quick question of, you know, how's it going, and that can open up so much.
That's true. Yeah, I've called my mom and said, "How's it going?" And about an hour later, I got another word in.
Yeah. Same here.
Yeah,
Same here.
exactly. Um, well, let's blend the two things that bring us together in both the service you do in every day and also as a leader in the Seattle Democrats. How do you see access to healthcare as an issue in this crisis, and particularly access to mental health care?
Yeah. So, good question. So, I think a lot of the focus has been on the health aspect, medical aspect, and not so much mental health. So, when you listen to the media or you listen to the local news, there's oftentimes talks about health and, you know, washing your hands, wearing your masks. And those things are very, very, very important. But mental health is also very important in a crisis like this. You know, research shows that when folks are going through any type of medical issue, really focusing in on mental health will tremendously increase treatment outcomes. That's really shown the research that whenever you focus on a person's mental health when they're going through treatment and going through anything medical, a lot of times those treatment outcomes are much better when a person is at a good stable level as far as their mental health. So really, Sam, I guess to answer your question, a lot of these things tie in as far as access to healthcare, really number one, um, with there being a crisis in our country even prior to this pandemic. It's been an issue with a lot of folks not being able to access healthcare and not being able to access mental health care. And one of the good things about where we're going right now, especially in the social work community, in the health community, is that we're realizing day by day that a lot of the access that we're finding now to link people to these services, especially in like low income communities and rural communities that really weren't receiving the care that they needed. We're realizing now in this pandemic, and I guess this is, you know, and I hate to say it this way, but this is one of the blessings, I guess, that's coming out of this pandemic, is realizing that all of these resources that we've had in our toolbox all this time, we can actually utilize this to improve access to healthcare. Honestly, you know, going out of this pandemic, hopefully whenever it's over, we can realize that things like telehealth and maybe having iPads and laptops given to folks that are lower income or in those rural communities where they can't really access healthcare readily. Knowing that these are things that we can do going outside. We don't have to wait until there's a pandemic to do this. We can do this together at any time.
Yeah, it's amazing. I've read somewhere that there are 164,000 South Carolinians who would gain access to health insurance if the state expanded Medicaid.
Yes,
Yeah.
and you would have so many different things in our toolbox that we could use if we had the funding for it. You know, and like you said, expanding Medicaid and really focusing in on access really would open the door for so much. It would not only just make my job easier, but it'll make the life of every client that I serve much easier as well.
Well, at the risk of running too far over time, because I know there's some folks out there who, you know, it's getting to be dinner time and maybe time for a drink or a beer or something. Don't want to get in the way of that. I've had a long day too, but I was doing a small business chat with Representative J.A. Moore the other day, and he called an audible on me at the end. He kind of asked me a question to throw me off a little bit, and I was going to do the same to you. So you can thank Representative Moore for this. But and this is a tough hot button issue. But what is the best 2 songs you would recommend adding to your playlist to help get through this crisis to lift people up?
That's a really good question. Oh man, you put me on the spot with this one.
I know, yeah.
I would say as a on the clean side.
Father to be here, folks, for those who are listening.
there's one song that I think would probably be befitting in this type of environment, and it's a song by older song, gospel song by Marvin Sapp called "Never Would Have Made It."
Ooh, okay.
And I think right now each of us could really say that we never would have made it without God. So I that's just something that I feel on my heart to really share. And the other one, I'll save that for for a private discussion.
Exactly. Good. Well, I'd be happy to chat with you all night, man. But I know we only told you 15 minutes and we've gone a little over. So really appreciate you joining us tonight, and look forward to seeing you in person soon. And thank you again for the work you're doing for our community and for our party.
Thank you, Sam. Thank you for the opportunity.
Of course.
Appreciate you.